The University of Cape Town has been ranked tops in Africa for sports science. That's in the global ranking of science schools and departments of more than 300 universities.
Well, in 2021, UCT was in the 41st spot. So for more on this, we've got Professor Vicki Lambert from UCT's Sports Science Institute of South Africa joining us for this conversation. Prof, thank you so much for your time this morning. First of all, I think congratulations to UCT. I believe that you are, in the top 14% globally? And then when it comes to the continent, you're ranked as top on the continent. To what do we actually attribute this ranking, especially when it comes to the way in which people are studying at UCT?
Faith, thanks very much. The Shanghai ranking is based on our publications in international recognized search engines, the number of citations, because it's no good publishing research if it's not actually being cited or used, as well as publishing in the top journals in your discipline. And I think the key strength of our research unit, and we're the research unit for health through physical activity, lifestyle, and sport at UCT, the key strength is our international collaborations. We have over 15 international collaborations, collaborating with probably more than 25 countries globally, and quite a number in the continent itself. And I think the idea is that we are disseminating our work, and I think it goes beyond the Shanghai rankings, because for us it's about translation. We want our research to be difference-making, to change policy and practice, and I think that's what we also feel very proud of.
Vicki, I'm a sports person, and I would be, I think, speaking on behalf of sports people who care a lot less about the theory and the studies and, the academic part of it, and more about what happens on the field. How does this translate to what UCT can contribute to what happens on the field?
Okay, that's a great question, Marina. And for example, we have work that deals from genetics, so looking at genetics both of sports performance, but also the sort of susceptibility to soft tissue injury. We have some of the best scientists in the world on soft tissue injury and genetics. But from there, we actually then go to, for example, we have individuals who have actually changed, for example, rugby rules practice through the BoxSmart program and the South African Rugby Union. We have individuals, for example, who have dealt with cricket bowling, both practice as well as injury prevention. We have people working, for example, in terms of cricket transformation. We have one of our researchers is actually in the U.S. right now, speaking in Pittsburgh, and he's focusing on research that is seeking to improve the sub-2-hour marathon performance. We have people who actually evaluate the injury, propensity for injury in races such as the Argus Cycle Tour or the Two Oceans Marathon. So we are very focused on high-performance sport, injury prevention, the mechanisms, and then translating that to changes in practice. But we also are very focused on the recreational athlete, and not just the recreational athlete, but getting people from no activity to doing something, because we know that physical activity is also beneficial for health.
Yeah. With all of these accolades, Vicki, one wonders, how is it that UCT still manages to have the inclusivity aspect of it? I think that we're at a time right now, especially in the South African context, where education is becoming a privilege, and quality education is becoming a privilege to a great front, just simply because of the nature of our socioeconomic dynamics. How then do we start building a more inclusive quality education space where, learners from across the globe, across the continent, particularly South African learners who may even come from disadvantaged backgrounds, may be able to benefit from some of the research, from the programs that we're speaking about even today?
Faith, that's another great question. And so, for example, we have one of the things that we're very proud of is that we were the first university to introduce sport and exercise medicine in the public sector. So we offer sports medicine services in the public sector through our sports and exercise medicine clinical service. The other aspect in terms of bringing on young people, we have something known as the Zipalele Mambo Fund, which was actually established on behalf of one of our master's students who actually passed tragically away quite a number of years ago. And we are using that to transform and to offer both scholarship and also to try to transform the students, I guess the demographics of students that are able to access the university education. And I think especially most of our work focuses on equity, has an equity focus. So particularly in interventions, we have one of our really wonderful scientists working in, for example, robotic walking in spinal cord injury. And in this project, she actually helped to have access to people who didn't have access to medical aid to make sure that they had access to this intervention. And that is Dr. Yumna Albertus. And so I think we have also been involved in a project with the Department of Higher Education and Training, where we are helping over 10 academics in higher education institutions who don't yet have their PhDs to try to achieve their PhDs. And that's part of one of our international collaborations.
Now, Vicki, I hear you speaking about, and as Faith is asking in terms of where transformation is concerned, that's one of the biggest sore points where sport in this country is concerned. I mean, how are you guys looking to ensure that, you know, this filters through to not just, you know, at tertiary level or at higher education level, but filters down through to secondary and primary education level, that this doesn't only start happening you know, not only for the disenfranchised, but even those that are, you know, in better positions. This doesn't just only start happening at the highest level of education, and it starts happening at primary school level, that kids start learning that there is such avenues and such a way of life very early on in their lives.
So we've been involved in various science expos to try to introduce children. We also have work study where kids can come, for example, during their school break and actually experience what we do here. We do collaborate extensively with the Sports Science Institute on a number of their programs. And one of the projects of which I'm very proud is a project which we involve. It's called Citizen Science. And we have Citizen Science, and it's basically focused on mobilizing and mobilizing, for example, student leaders in high schools to actually identify the factors which within their environment make physical activity more difficult and challenging, and then giving them the tools to actually do advocacy and to sort of speak truth to power. And we have a number of pilot projects we're working on now, and that's also being replicated. Another aspect which we're involved with is the Healthy Active Kids South Africa report card with my colleagues Rowena Naidu at the University of KZN and Professor Candace Christie at Rhodes University as the co-leads. And this is also an opportunity to kind of get a feel of what's happening in schools, and then to actually have an advocacy document that we put forward to government and to non-government role players. And I think we are involved in various high school initiatives where we try to actually make the discipline more, I think, more accessible, if you like, to young people. The other factor which I think is critical is for the biokinetics, which is a clinical discipline, which is where exercise is the therapeutic modality. And I think biokinetics should actually be located in the public sector, and especially in schools, where we know schools, and particularly where they have sports events, kids get hurt. And this is to prevent and also to manage.
Yeah.